Today, we wanted to talk about a topic that we get asked at almost every speaking event that we attend. Many high school and college students wonder if they could actually afford to become a doctor. The thought about how many years it takes to be a doctor and having to finance your way through loans can be such a scary thought. I know this indeed did cross my mind many, many times, even in medical school and beyond. Well, today we're going to tackle this topic and give you some ideas on how you can hopefully save some cash as you finance your way through college, medical school, and residency. Dr. Marina and I did not have a financial coach or a financial mentor along the way, so we probably got into more debt because we just didn't know. Perhaps some ideas that we share today can be helpful to you throughout your journey so that you don't make some of the mistakes we did. Now, I'm not saying that getting a medical degree is cheap, but if you can cut several spending dollars here and there, it adds up to a lot of money that can be saved in the long run. So, most of you guys know about scholarships. Generally, with these, there's an application process. Many exist depending on the purpose of the scholarship. And sometimes university will automatically give it to you depending on your college application because you meet certain criteria. So, for example, if it's needs-based, academics, or sports, you don't necessarily have to apply for it. The colleges will just offer it to you when they're reviewing your application. Then there's grants. This is awarded when you apply through FAFSA, and it's financial need based on your parents' income taxes. Basically, this is just gifted free money to you by the government. Then there's monetary gifts that sometimes family, the community, or friends can give you. And then there's work study. And this program is designed to help college students find part-time work and offset education expenses. The FAFSA application determines whether you qualify for this or not. Funding mainly comes from the government to the college, and then you get paid for the hours worked. Usually, it's an on campus job that is very flexible to help you to be able to academically succeed as well. While this is not technically free money because you do have to work for it, it is money that you don't need to pay back. So, how much you make will really depend on your specialty, and this can range anywhere. And then, depending on how many hours you work, but say the 150,000 to say 500,000. It really just depends on your situation. Therefore, some medical specialties that make a lot more money will allow you to just pay your loans off faster because you have so much money. And then we talked about also the physician loan forgiveness program. Again, this program will forgive whatever amount you have left after you make 10 qualifying payments. If you work for usually it's like a federally qualified health center or organization that works with low income patients.
Yeah,
And
just to clarify
yeah,
it with that, it has to be 10 years of monthly
yes,
payments.
you do have to be full time, and they count full time 30 hours or more. So you have to at least
Hmm.
be working 30 hours.
Hmm.
And then there's also state loan forgiveness programs. So every state will likely have their own program for physicians, depending where you work, and they'll provide money to help you pay for loans. In California, we have one where if you work up, I believe it's like 5 years in a nonprofit, you can get paid, your loans paid up to $300,000. And then there's another one in California as well that they'll give you $50,000 or more for 2 years of work and qualified employment as well. And I'm sure every state has their own program. So it's something that you can look into, even though you're a full salaried physician, these are still ways to help you pay off your debt. And
Hmm.
then there's also the National Health Service Corps. You can apply to that program, and again, up to $50,000 for every 2 years worked, or $75,000 for every 3 years if you work in a qualified employer. Or I've had also some friends that did this from medical school. They joined the service. So they joined the Health Profession Scholarship Program before starting medical school, and then the military covered all of their tuition and their educational expenses. But in exchange, you have to give them 4 years of active duty as well. But some medical students do this as well.
Hmm.
And
Yeah.
then lastly, remember that you will be a high income earner. I think this is the hardest one to imagine when you're in high school and in college and going through those rough times, that you'll be able to financially manage making these payments for these school loans as well. So you will be fine in the long run. But again, all these things we talk about is just saving some money here and there because it really, in the long run, will save you thousands of dollars.